When you're having health issues, the last thing you want is so much aggravation.
Todd Bash, a part-time teacher from the Los Angeles area, has been searching for a diagnosis for a spinal problem and an explanation from his insurer for his medical bills.
What are these extra charges? And they informed me that it was a hospital facility fee. So I explained I wasn't at a hospital, I just went to a doctor's appointment.
But what he learned is that even outpatient doctor's offices, like the one he went to, can charge facility fees if they're owned by or affiliated with hospitals. And with insurance deductibles increasing nearly 50% over the last decade, consumers are paying more for these fees.
This is a breakdown of an injection I had.
After getting an epidural steroid injection at a pain center which has hospital branding, his insurance was charged more than $14,000 just for facility fees. Todd's out-of-pocket costs nearly $700, all for an injection that he says just took a few minutes.
It's shocking.
Even more shocking, he was also being charged a facility fee for a telehealth appointment about the injection.
It seemed shady and dishonest and frustrating.
It's happening more and more. In 2012, just about a quarter of U.S. physicians were employed by hospitals or health systems. Today, it's more than half. Critics say that leads to higher prices for the same care.
They're just pasting a giant corporate name on the front of the clinical facility and charging more.
Dr. Brian Miller, an internal medicine physician at Johns Hopkins Hospital, studies healthcare policy.
The level of service you're getting is actually the same. They're just charging more, 60 to 70% more money for it. And that's like paying for a Mercedes and getting a Hyundai.
19 states have passed facility fee laws, many requiring that providers warn patients about the fees. According to a budget watchdog, if providers charge the same price for the same service regardless of the location, Medicare would save $150 billion and commercial markets would save $458 billion over the next decade.
Facility fees are, frankly, about maintaining access to care in a community.
Molly Smith, the vice president at the American Hospital Association, says facility fees are essential and allow hospitals to maintain 24/7 care.
What a patient has to pay out of pocket for a service is actually determined by the type of healthcare coverage that they have.
The American Hospital Association is saying that this is partially the fault of the insurers. Insurers we've spoken to are saying the blame is on you. Where does all of this leave the consumer?
Hospitals are there to deliver services to their community. And frankly, that does take resources.
We've spoken to several patients across the country who have described these facility fees as shady or a scam or dishonest. What would you say to them?
I would say that facility fees are absolutely essential to maintaining healthcare services in their community. Without facility fees, I can't underscore this enough, physician practices are not going to be able to sustain themselves under their current business model.
It took Todd months to find an independent doctor, but when he finally did, he was able to get the same kind of injection that cost him $700, and this time...
My share is $37.17.
$37 for the same service.
The same exact thing.
The only difference, he says, is the sign on the front of the building. Gotti Schwartz, NBC News, Los Angeles.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.